Hello and welcome to the Middle-Aged Encyclopedia. Lupus is a chronic autoimmune illness that causes inflammation throughout the body as a result of an immune system malfunction. The appearance of a butterfly-shaped erythema on the face distinguishes it. The majority of lupus patients are women, particularly young women in their 30s and 40s of childbearing age. Lupus symptoms might arise suddenly or gradually over a period of 10 years, making diagnosis challenging. Furthermore, because lupus can infiltrate the kidneys, heart, lungs, blood, and cranial nerves, early diagnosis and therapy are critical. Then we'll look at the causes and symptoms of lupus today. We will discuss how to prevent lupus at the end of the video, so please watch until the finish. Subscriptions and likes enable me to create better videos. Several factors, including genetics, hormones, the environment, and viral infections, have been implicated in the development of lupus, but no single cause has been established. Overexertion, emotional strain, and UV radiation are all contributing factors. Lupus sufferers, in general, have photosensitivity. Lupus may also be brought on by a lack of a certain vitamin. The first symptom of lupus is fatigue. Fatigue affects at least half of those who have lupus. Fatigue can be caused by the illness itself or by secondary factors such as sadness, worry, inactivity, and sleep disruptions. Avoiding the sun can lead to low vitamin D levels, which can exacerbate fatigue in persons with lupus. Talking to your doctor about your fatigue is crucial. Fatigue is a problem that can affect quality of life no matter what is causing it. Second, hair loss. Lupus frequently manifests itself initially through hair thinning. Inflammation of the skin and scalp causes hair loss. Lupus can cause hair loss in patches for some people. Hair loss typically occurs gradually. Some patients may experience a gradual thinning of their facial, brow, and eyelash hair. Because lupus can make hair dry, brittle, and break easily, it's often referred to as lupus hair. Lupus treatment frequently results in regrowth of hair. However, lesions on the scalp might cause permanent hair loss in the affected areas. Third, pulmonary issues. Lupus symptoms might also include respiratory system inflammation. Lung inflammation can spread to impact blood vessel walls. The diaphragm could be impacted as well. Breathing in can be painful if you suffer from any of these illnesses. Pleuritic chest pain is a common name for this ailment. Lupus-related respiratory problems might cause gradual reduction in lung size. This illness is characterized by persistent chest discomfort and shortness of breath. Shrinking lung syndrome is another name for this condition. Fourth, skin rash or lesions. The butterfly-shaped rash that often occurs across the bridge of the nose and both cheeks is a prominent lupus symptom. This rash affects about 30% of those who have lupus. It can happen all of a sudden, or after being out in the sun. In certain cases, a rash will develop right before a severe episode. Lesions that are not itchy can also be caused by lupus. Hives are an extremely uncommon symptom of lupus. Lupus sufferers often have flare-ups when exposed to bright sunlight or artificial light. Some people's fingernails and toenails become discolored. Fifth, swollen joints. Joint pain, stiffness, and apparent swelling, especially upon waking up, are all symptoms of inflammation. It could start as subtle but intensify with time. Lupus symptoms, including joint pain, might come and go. If non-prescription pain relievers aren't working, it's time to see a doctor. It's possible that superior therapies exist. But it's up to your doctor to figure out if your joint pain is due to lupus or something else, like arthritis. Sixth, headache. Lupus patients are twice as likely to get migraine-like headaches as the general population. Raynaud's syndrome is associated with an increased risk of headaches. Vasculitis, an inflammation of the brain's blood vessels, and blood clots inside these vessels, both of which can develop in some lupus patients, are two other potential headache triggers. 7. Mouth or nose sores. In roughly 25% of lupus patients, ulcers develop in the mouth or nose. If you develop any sores, including cold sores or herpes lesions, you should inform your doctor. Immunosuppressive medications, such as those used to treat lupus, may increase the risk of herpes outbreaks. 8th, gastrointestinal problems. Heartburn, acid reflux, and other digestive issues might occur occasionally for some persons with lupus. Over-the-counter antacids are effective for mild cases. If you suffer from acid reflux or heartburn frequently, reducing the size of your meals and avoiding caffeinated drinks may help. Also, avoid lying down soon after eating. See a doctor to rule out more serious illnesses if your symptoms persist. 9. Thyroid problems. Lupus patients frequently experience the onset of autoimmune thyroid dysfunction. The thyroid plays a key role in regulating metabolic rate. The brain, heart, kidneys, and liver are just some of the organs that might be negatively impacted by a malfunctioning thyroid. Weight growth or loss is another possible outcome. Mood swings and dry skin and hair are further symptoms. You develop a cold when your body's immunity is impaired by stress or lack of sleep, and this virus promotes lupus disease. To avoid catching a cold, it is critical to improve your immune system by eating a well-balanced diet and exercising. Furthermore, a lifestyle that keeps the oral and nasal mucosa clean is required to prevent recurrence and worsening. Because omega-3 has a strong anti-inflammatory impact and slows the progression of lupus, it is beneficial to take supplements in addition to dietary restriction. You must engage in regular cardio and strength training, as well as receive enough sleep. Furthermore, because lupus is photosensitive, it is critical to protect oneself from the sun by wearing a hat and applying sunscreen. It is treatable with continuous treatment and a diet high in vegetable protein. Today, we learned about the causes, symptoms, and prevention of lupus. Leave a comment below to let us know if and how much this video has helped you. I'm waiting for you in the next video. Subscribe to our channel for more informative videos like this one. Thanks for watching the video.